Hi, this is Dr. Sabrina Akrami, presenting another topic on chest pain today. Thanks for all the positive feedback and support on the previous two videos. I really appreciate it, and all the subscribers and thumbs up and positive comments. So after several requests, I'm just going to go ahead and give another topic. I really enjoy giving these little talks. So today's going to be on chest pain, and chest pain is a wide variety of complaints and issues, and it's one of the top consultations I get. I am board certified in cardiovascular medicine and internal medicine. So just background a little bit. Okay, so there's several different types of chest discomfort. People can describe dull pain, pressure, aching, squeezing, whatnot. Oftentimes what I'm worried about is the heart pain is usually described as like a sharp pain or heavy pressure, like an elephant sitting on your chest, sometimes radiating to the neck, the jaw, the back, or the left arm are very common, but not necessarily. Sometimes people just can be having a heart problem, including a heart attack, and just have flu-like symptoms or fatigue or nausea, vomiting, or those kind of things. So first things first is just, the type of chest discomfort someone's having and the location. So usually heart pain is more left-sided. And then there's all different types of chest discomfort causes. So the most common causes are usually not the most dangerous. So the most common causes would probably be musculoskeletal, which is kind of like muscle aches. For instance, if you're doing like a new exercise routine, or you're lifting like a lot of heavy boxes at home or at work, or sometimes parents or grandparents are babysitting or watching the kids and lifting the kids up and down. Usually musculoskeletal pain is more positional, and it's certain positions make it better versus other positions make it worse. And then another big one is GERD, or indigestion, or acid reflux. Usually people describe that as a burning sensation going, we say retrosternal, or basically going up the middle of the chest and going up. Usually they describe it worse with spicy foods or heavy foods or caffeine or coffee, and then it usually is worse when they lay down at nighttime. And that's because during the daytime when you're digesting and you're sitting up, gravity kind of helps push everything down. But if you eat like a ton of food, heavy foods, spicy foods, and then you lay back right away, there's a lot of reflux that could happen and cause some of those symptoms. And then another huge one is just anxiety or stress. And sometimes anxiety and stress can be so powerful that you can actually get chest pain, very similar feeling to someone who's having a heart attack, and it can be very scary. So sometimes the doctors don't even know until we do a basic checkup or run some basic tests to see, and sometimes we get surprised also. So nobody will ever fault you if you go to the hospital or to your doctor and say that you're having chest discomfort. We'll take it very seriously, and it deserves an appropriate workup and evaluation. So just a reminder, if you are having any chest discomfort or anything like that, the most appropriate thing to do is to go see your healthcare provider or physician so you can get a thorough workup and appropriate evaluation and treatment. Sometimes it can be serious, and that's why that's important and not safe to do like over the internet without seeing you and giving an exam. So other things about heart pain are duration. So if you're getting more and more chest discomfort, worse with activity or exercise, and then when you stop it seems to get better, and then over time it seems to get progressively worse, like more intense or lasting longer or with less and less activity, that could be concerning for heart disease as well. Sometimes breathing can be associated with it, and we already talked about stress and food are the big ones basically. So some other causes of chest pain, and these are the ones a lot of times that we worry about, are obviously heart attack, or we call it a myocardial infarction, which is basically cholesterol or inflammation build up in your heart blood vessels that get occluded is the word we use, or blocked would be more mainstream kind of terminology. Other things are like a blood clot in your lungs, pneumonia, aortic aneurysm, which is the biggest blood vessel in your body, going from the heart, pumping through that to the rest of your body, giving nutrients and blood. Sometimes can be enlarged, and sometimes can cause what we call a dissection or tear, which can be very dangerous. Ulcers, asthma, costochondritis is another one, where it's kind of inflammation of the lung lining, can be worse with deep breathing. Irregular heart rhythms with the heart's electrical system we touched on before. And then shingles is a surprisingly not that uncommon. Sometimes people will have a lot of chest discomfort and then a day or two later in the hospital they'll break out with shingles, which is like a type of recurrence of chickenpox, which can be contagious and is pretty miserable. And then we have like pericarditis, myocarditis, which is basically like inflammation of the heart lining, of the heart muscle, which can all be pretty miserable and not fun. And one thing I'll mention is that we get a lot of patients are very frustrated and upset for understandable reason. They go to the hospital with chest discomfort, they keep them there for a day or two or whatnot, and they rule out all the dangerous stuff, and then they send them home to follow up with their primary doctor. And they'll be very upset and say, I came to the hospital and you guys didn't even tell me what the problem was. So unfortunately in the hospital setting, the doctor's job is mostly to rule out all those life-threatening, dangerous things right off the bat, even though they might not be the most common things. And then once they rule those things out, a lot of times they'll have you follow up, not to say, that's it, you're done, but to follow up with your primary doctor or like a stomach doctor, a gastroenterologist, or a lung doctor, a pulmonologist for further workup. And once in a while, sometimes we still don't even know what the cause was, but at least we try our best to rule out the dangerous stuff. So that's the honest truth. And then as far as when you go see your healthcare provider, different things that they'll do is, number one, a thorough physical exam head to toe, check your blood pressure, listen to your heart and lungs, check your pulses, all these good things. Might check your temperature, your oxygen level. And then if you're having chest discomfort, almost guarantee that they're going to want to do an EKG, which is they just put a bunch of stickers, 12 different ones, 12 lead EKG, and it gives them just like a few seconds printout of what your heart is doing, and that'll give them a heads up if you're having heart attack or irregular heart rhythm. Gives us a lot of good information, and most oftentimes helps us rule out like a heart attack or something like that. Other important things are like chest x-ray. So we get surprised sometimes someone has pneumonia, bronchitis, fluid around the lungs, those kind of things. So chest x-ray is a pretty common test to do. Another one is just basic blood work. Make sure you're not anemic, your electrolytes are okay, your sugars are okay, everything is doing good. And then as far as heart testing, other stuff would be like an echocardiogram or ultrasound of your heart, which most people are familiar like with pregnant patients when they get an ultrasound for their abdomen, for the baby. This is very similar ultrasound or echocardiogram for the heart. So it's more specialized, and that's very good. It gives us a couple important things, like for instance, the heart muscle squeezing strength. So if someone had heart attack, we could see like a weakened wall muscle, fluid around the heart. It'll show us your valves opening and closing to see if there's any issues, sometimes holes in the heart. So that's a nice picture and whatnot. And then a little bit different than that would be like a stress test. And a stress test is nice because it's checking for those little blood vessels in your heart that can get clogged up or occluded with cholesterol and inflammation. Those are the ones that sometimes can cause heart attack. So a stress test, depending on which one they use, there's a lot of different kinds, but if they combine it with imaging, can be up to like 85-90% accurate, which is a really nice test. So usually the first part of the test, they'll have you run on a treadmill, they'll hook you up to an EKG monitor, checking your vitals, blood pressure, heart rate, and that kind of thing. They'll try to get your heart rate up to a good level to make it a good test. Every 3 minutes, the treadmill will go a little bit faster and a little bit higher. And they'll look at the EKG to see if there's any big changes on your heart rhythm that would be concerning for underlying heart disease. And then sometimes they'll combine it with pictures, so that would either be with the echo or ultrasound again of the heart, or a nuclear camera where they have you lay under an open camera with your arms by your head, and they take pictures of your heart for 15 minutes before and after and see if there's any changes in the pictures before and after that might warn them of some big blockage or narrowing in your heart blood vessel that might need further treatment. And then a little bit more aggressive would be something called a heart catheterization or angiogram, which is a procedure where they actually go inside and look inside your heart blood vessels to see if there's any blockages or anything like that that need to be fixed or treated. That test they usually do in the hospital. If you do well on it and there's no problems, a lot of times they'll let you go home the next day. But if they need to fix something, a lot of times they'll let you go the next day depending on what it entails. So they go in the blood vessel, usually in the wrist, the radial artery, or in the leg, and usually that's most discomfort people feel because they give a little numbing shot there. But there's no general anesthesia, no major cutting or anything like that. They give you medicine in the IV to make sure you're comfy and a little bit forgetful sometimes. So you're nice and cozy in a safe environment with, they're checking your blood pressure, your heart rate, and all your oxygen and all that. So that's a nice test. If they go in there and they see it looks good, they'll come back out. If they go in there and they see a little bit of cholesterol buildup, they might come back out and recommend medication and or what we call risk factor modification. So that means good blood pressure control, good sugar control, good cholesterol control, diet and exercise, and routine visits and that kind of thing. If they see something like about 70% cholesterol buildup or heart disease in there, they may try to fix it while they're in there with a little balloon to open up and smush the cholesterol up against the wall, and they might leave a little tiny metal stent in there to keep it open. They'll take the catheter out, they'll take the balloon out, and they'll leave a little metal stent in there. And when they're in there, when they take pictures, they give a little bit of dye through the catheter, and they're taking x-ray pictures. So that's how they can tell how much narrowing or occlusion or blockage you have in your heart arteries, is they're putting dye through and they're taking x-ray pictures to see how well the dye goes through. If it doesn't go through at all, it's 100% blocked. It could be like 10%, but usually it has to be about 70% for them to warrant going in there and fixing it for you to have improvement from that. And then worst case scenario, which hopefully nobody ever has to have, but sometimes is needed, is if there's 100% blockage or a complicated situation, they may recommend like a surgical evaluation for possible open heart surgery or CABG or bypass. But they have really good outcomes, and they do very well. So I hope that was just like a nice brief update on chest pain, just the basics and whatnot. I hope that was helpful to you guys. And if there's any other topics that you'd like to hear, please comment below. And please give thumbs up and subscribe if you enjoy these videos. I really enjoy making them. So thank you so much.